welcome to the Ripple Effect Podcast. I'm your host, Lindsay McNally, co host, Champ Jones, and today's guest is Justin Pittman. We hope you're doing well, so we'll get right to it. Hi, Justin.
How are you? Thanks for having me.
Yeah, glad you're here.
I really appreciate it.
So, we both work at Three Rivers District Health Department.
We do.
Why don't you tell the listeners, the viewers, what you do?
Well, that's a complicated answer, I guess.
Let's start. What's your title?
I'm the serve currently as the deputy director. I'm over the environmental health and our public health preparedness programs as well as our facilities.
Wow. So, what does it mean to be a deputy director?
Well, it can mean a variety of things based on the agency. In my case, I guess I focus kind of on those three main branches with our agency, particularly environmental health being probably one of the more dominant ones that we do.
And your other part of your job is what is that title?
The other part of my job, public health preparedness, that's actually our planning for our agency and response plans for emergencies. So that's how we are involved with the community during emergencies.
Okay. So how how is a response from Three Rivers different than like the county's emergency response?
Well, generally speaking, public health will serve some very specific roles in an emergency, and that varies per emergency, of course. So a lot of times with a natural disaster, say a tornado or a flood or something of that nature, we would have very specific needs that we need to come forth with, maybe some vaccinations for exposure of flood waters. Maybe it's food safety issues with power outages that are extended over a period of time. So those are things that really aren't encompassed in the normal package of emergency response, but particularly in ESF 8 section of that emergency support functions.
There's a lot that goes into emergency preparedness. So if you're doing your part, but the county isn't doing their part, and vice versa, does that create a storm? How does that look like?
Sure, and that's the county emergency manager's role really is to try to get all of those ESFs or support functions that he has in his plan to kind of work together within the EOC or Emergency Operations Center.
Okay, I'm learning that. I'm sitting right here for the first time. Well, what else do you want to tell us about your time here? Now, you have been here for how long?
It's been 28 and a half years.
Wow. You have been here, I don't know how to say it. So, we have been a district for 50 years.
That's correct.
You have been here more than half of those years.
Yes, I have. Yeah.
I said it right.
Yes.
See?
You've been here longer than I've been alive.
Wow. Wow.
Longer than our producer has been alive. Is that what you said?
Wow.
Wow. Thanks a lot. Yeah.
So, yeah. How old are you?
I'll be 26.
Oh.
Yeah, she's,
Well, yeah, so you have been here for a long time. You've seen a lot of things. How has public health evolved in the last 20, how long? 26 and a half?
28 and a half.
28 and a half years.
Wow. How has it evolved?
How old were you when you started?
Uh,
20? 21.
I was fresh out of college when I started. I was about 23, I guess.
Okay.
So,
Wow. Now, okay, were you married?
I was, yes.
So your poor wife has been
Yes.
there this whole time.
She has, yes.
Good for her.
She's a strong one, yeah.
Yeah. So, okay, tell us about how has it changed in the last 28 and a half years? Not just Three Rivers District Health Department, but public health, your job, and then you tell us.
Well, I guess from an environmental health standpoint, it's changed more ways than I can count, mainly for technology, laboratory procedures, just things that are available to us. I mean, the things that we can do now as far as lab sampling versus what we could do 20 years ago is a completely different animal. The politics are a
No
completely
pun intended.
different animal than what we were before.
Totally different animal head, everything.
Completely, yeah. So I think a lot of those procedures have changed just for technology's sake from an environmental health standpoint. But on top of that, it's the update in the regulations. So, I mean, that's something that we constantly have to update from a state. It's food code and different things of that nature. And those really change and require our regulation to be different when we go out to our establishments.
How often do they change?
The FDA actually updates it every 3 or 4 years, but Kentucky has to adopt that, so it takes us sometimes a little bit longer. Right? Currently, we're on the 2013 code, but we're working on getting to the 22 code.
2022?
Correct.
Okay, huh? It's 2026 right now.
Correct. Yeah. It's when the federal codes are made. So
Okay, so it's not like they change every time you turn around, you get an email, there's a new thing to remember. You do have some time to.
well, for federal codes, sure. In state, every year we have a legislative session. So each time there could be a bill filed that would change our local
Oh,
regulations, that would be state regulations, maybe not federal. So
yeah.
you got to look at it from both standpoints. It trickles down from the federal level to the state level to us. So all of that matters.
Yeah, and you have to be aware of it, and you, as the head of that department, has to make sure your team knows and that they're educating the public on that too, because
100%. Yeah.
that's who they're working with.
It's a hard thing to stay atop of. Sure.
Wow. So, as an environmentalist, there are things that you do and there are things that you don't. So let's play a little Mythbusters. Myth number one: when there is a pack of coyotes in the wild, do does the health department have anything to do with wild animals roaming free that may be um, rabitus? I don't know the word. It might have rabies.
Well, from the health department standpoint, with wild animals, if you will, our main concern is zoonotic diseases that might be transferred to humans. In this case, it might be rabies control from environmental health. Uh, so, really, when we have a pack of coyotes in your yard, I'm not really that's really not my forte. But if one were to come in contact with a human, for example, then we would certainly want to follow up with that to make sure that the human did not contract disease from that wild animal. So, if possible, we would want to go that. But that's really where our focus is on that human disease, not necessarily the wild animals themselves.
So when you say come in contact, you mean bite,
It can be a bite. It
not
can be
just pass by and, oh my gosh, it's so cute.
sure. It
It's
could be a bite. It could be a lick. It could be a scratch. It could
oh,
be any contact with
okay.
saliva or something that maybe have got came in contact with saliva, like a paw.
Oh, okay. Myth number two is that the health department goes into a convenience store, a grocery store, and makes sure that the expiration dates on the food on the shelves are up to snuff. Is that true or not?
Not necessarily. The qualitative type expiration dates, your cereals and things. Most of those things are voluntarily pulled by the retailer or the manufacturer. They'll go to a salvage, and they can generally be sold in other ways, even expired, because it's usually a qualitative issue. When we're talking about something that could affect the food safety, that's completely different. Not just the staleness of the cracker, for example, but perhaps some deterioration of the product that would cause pathogen growth. Those items we might be way more focusing on an expiration date than something else, such as your cereals and your things on the shelf in your convenience store, if you will.
Okay. So, like the hot dogs on the roller, you all are going to be more worried about that than the
Yeah, I mean, the
donut
hot dogs
section.
on the roller gets into a food service type practice, so certainly, I mean, that's a whole
Oh,
different
okay. That's
set
a
of rules.
different.
Yeah,
Okay, so that's a different thing.
yeah.
So you got, but does the health department, not just ours in general, but do health departments typically do that, or are you counting on the word of that business owner to say yes, I have done this, and how does that go for you all? Usually pretty well.
Yeah, so I mean, we do regulatory inspections of all of these facilities, by regulation, whether it be restaurant, whether it be grocery store, hotel, tattoo,
Hmm.
body piercing facility, schools.
Really, you do like body piercing tattoo parlors?
Yes, we do. Yes, we do.
I never thought
Just
about
about any public facility like that, we do regulatory inspections on. So those are generally done based on the codes and how long apart those are, varies based on their risk type. Most of them are about every 6 months currently, at least when it comes to our restaurants and food service. So we really get a snapshot of that in there. But I think every day that's what our environmental health specialists are doing. I mean, they're behind the scenes for the most part, kind of doing that unseen profession and protecting the public every single day. It's really probably the only branch of public health programs that we have that every single person in the community is affected by, because everybody eats at restaurants. We all swim in pools. We do these things. So those regulatory inspections that you don't even know happen guarantee that set of standards when you get there. And then sometimes what's really weird is things go wrong. And then those regulatory authorities that are behind the scenes and not used to being out in front suddenly have to be pushed to the forefront. So it could be a foodborne outbreak investigation. Suddenly that regulatory hat turns into an investigative hat.
Mm.
It could be a Legionella situation in a nursing home, which is not something we regulate, but we would be involved in. And then it gets to the emergency and disaster response that we talked about a minute ago. Those are very specific roles that push you right to the forefront and change that regulatory hat to something else. So it's a highly adjustable thing that these folks have to do.
So it's mainly proactive, but another part could be reactive.
Absolutely.
And that kind of leads me into the next question. What would happen if or what could happen if your environmentalist specialist did not inspect a piercing parlor or a tattoo parlor?
Well, hopefully nothing. I mean, with the education that we give these folks, we hope that they're following the procedures because we're not there every day. We're only there for a snapshot. But really, what we want to do is assure those practices are going on. People change in these facilities, particularly when you talk about food service. Every time we go in, it's a different staff sometimes. So you've got to understand that we want a constant level of education and assurance that goes on with these facilities. Hopefully, every day they're practicing it, but in my experience, it takes a little shove here and there.
It's really good knowing that the communities in at least in our district, Three Rivers District, can sleep good at night knowing that your professionals are out there keeping them safe, keeping their kids safe at school, keeping their jobs safe and them, just safe in general with what they eat, what they put in their bodies, what put they on their bodies, that type of thing. Public that part of public health is the unseen that if you don't know what public health is, it's a good thing. It's one of those what people say because that means that we're doing our job. So
We certainly try. That's our goal every day. Yeah.
yeah, that's great. I asked our director last time, what do you want your legacy to be? So not so much yours, but Three Rivers. How do you want to what you have done, the imprint you've made? How do you want that to carry on with Three Rivers in the next generations to come?
Wow.
Yeah, came right out of my head.
Wow. Well, I mean, I think any little part I've played in this agency's success in my career, through accreditation, through development of state policies and procedures and different things that we've been able to accomplish here, I'm super, super proud of. And I think that in and of itself will carry on for a long time because it's literally something in place that we've been able to accomplish here. I think, from a personal standpoint, really, I think the biggest goal and legacy that you can leave from a public health standpoint is just being able to be a resource to your community. When I moved here, I was a kid out of Western Kentucky. I go to Carrollton and I start a job, and my whole goal was just to be a resource for Carroll County, Kentucky. And so 28 years later, to be looking at and be a resource for 4 different counties in our district, I think that's about as much legacy that I know to get.
I think you're right. And that's important, like you said, to be the resource, to be the people that people can call. Because a lot of people, when they think, oh, the health department, that's the food inspector, that's the
Sure.
and that's okay. If that's the only thing people think of, that's okay because at least they know who they can call,
Absolutely. Yeah.
and there will always be someone that answers, and that person says, actually, you want to do this, we can hook you up with all these other programs. So public health is not like any other entity in our society because we are like the what's the word renaissance man.
Renaissance.
You know what I'm talking about.
Sure. Yeah.
So we are the renaissance man for societies.
Oh wow. That's
We
I
know
like
how to
that.
do a
Yeah.
little bit of
I
everything.
like that.
So yeah. Oh, there's a decrease, I think, right now in public health workforce, especially environmental. So, do you think it has to do with why is it? Is it because there's more of a trade push these days? Is it because there's just a new generation of types of kids? You think there's not as much, um, spotlight on public health? I know that some colleges are doing a great job of making that partnership with public health and their college. So, what why do you have any idea why there's not as many people out there in the environmentalist field or that? And also, what do you need to be for an environmentalist? Because when I learned what it was, I was really shocked. So all those questions
Yeah,
answer
so
them
I,
now.
I guess I'll start with the second question first, and that is essentially a biology emphasis with at least a bachelor's degree is what we look for. So some sort of biology emphasis that allows them to sit for the state exam, and that state exam is a registered environmental health sanitarian. So they can pass that exam, and then of course they are licensed to do the job. So that's how that works with that. As far as
Do they take that test any like they get their bachelor's and then they take this test before
it's
they even have a job?
correct. They can. That's the
Just
way I did it. Yeah.
oh,
It actually helps get them hired. If you're already got that certification, it's kind of not a bad thing. It's a tough
cost
test,
does it
but
cost money to take the
it does.
test? Okay.
Yes.
And are there certain amount of hours of biology classes or like how many what's that look like? Or does it I guess it maybe is up to that
I
college.
believe what the committee looks for is at least 12 hours of some acceptable biology in their transcript to see if they're allowed to sit for the exam. So we have a committee at the state that actually reviews that.
Wow, that ain't nothing.
It's not nothing. No.
That it's they somebody could have all those classes and actually be going into something else, like nursing, and then get out, hate nursing, and be like, well,
Sure, they
I
could.
have the right degree. I could probably take this exam, and so people who are going into those fields with those biology type focuses, they do you think that colleges are doing or not? I don't want to say good job, but what can colleges do to maybe broaden that you know lens to say, hey, here's your other option. You don't have to just be a nurse. You don't have to just do, not saying just be a nurse. You know what I mean? I love you all. But there are other options out there that you may not have
Sure.
considered.
And I think a lot of the universities, at least in Kentucky, are already doing that. I mean,
Mhm.
there's some environmental health programs that are MPH programs coming out. And in those programs, some of them are even pushing to take the REHS exam before they graduate. So literally,
Mm.
when they graduate, they are licensed to come to work for a health department. But I do think that there's branches of public health in different ways where you get into the private industry, like you say, where it's really more called industrial health, and that's basically the public health within those private entities. So I do think there's branches of people going different directions for that, and there's probably a multitude of reasons why.
Okay. What if this 20-year-old kid's in college is like, I want to get a job, but I don't want to spend money on that test because what if I hate it? Are there apprenticeships out there that that are welcoming and like, like yeah, are there?
Absolutely, we've done it here. I think at the state level there is an official apprenticeship program that they can get into, and then on the local levels, a lot of times local health departments will get involved in that as well, either through that statewide program or through their own.
Like they contact the Department of Public Health?
Yes,
Oh, okay. Do you know um, where is that?
it's in Frankfurt. Yeah,
Okay. And so does a person just like Google Department of Public Health Environmental, look
that
it
would
up,
get you there. Yeah,
call them,
that would get you there.
or they
Yes,
could call
environmental health
here
sanitarians. You can
until September, something they could call you.
sure. Yeah.
Okay. Well, that is great. That's good to know because I do like that Three Rivers welcomes young kids to shadow and to learn and to do those apprenticeships because what if you get into it and you hate it and you spend all this money and all this time? That's a good thing. But I feel like, do you think that most of them who are in apprenticeships end up sticking with it?
I do. I think once you get here, you like it because it's if you don't like sitting in an office all the time and you like getting out and being flexible, this is a gig. So, and I do think a lot of times they get in that and they don't want to go back.
Right. Yeah. 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 Okay. Well, that's it. Thank you for your time.
Thank
This
you.
has been informative, and I hope that we get some feedback from people who are interested in this position. And, it could even open up whole new, there's new generations that have bigger ideas than yours.
100%. Yeah.
So I hope that that continues and that this, type of thing grows. So anyway, thank you all very much for your time. And that is all for the ripple effect today.